My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Tritathon, the Lupus Day. Antenatal care is a very special aspect of maternal care. It starts from the moment of diagnosis of pregnancy till when labor starts. In our unit, we hold antenatal cares on Tuesday, and then our antenatal care is almost matched up with our immunization. Immunization comes up normally on Friday. So most women you see in antenatal care, if you don't see them again in antenatal care, you assume they've already delivered, and then you start looking for them in the immunization days, and that is the day you will now see them. So most times our immunization day, apart from being the day we immunize our baby, it is also a day we come and rejoice with our formerly antenatal care patients. We now come and rejoice that they've given birth. Okay, so my story starts with this very special Friday. So now, during this Friday, I came in to address the women in immunization. So I took notice of a very friendly one of them there, and I called her out. So I noticed she was carrying one baby. During the antenatal care, I was the one that did the first ultrasound scan on her, and I diagnosed twin pregnancy, twin gestation. And of course, I knew when she came for labor, and I know when she entered labor, and I know when she delivered, and she was delivered of a boy and a girl. So that was the last I saw her till this very antenatal. So when I now saw her, I was like, oh wow, what happened? How is the other twin baby? Who is carrying the other twin baby? She now told me it's a long story. I said, okay, well, no problem. Maybe after the immunization now, we'll now see. So after the immunization, I approached her. I was like, what really happened? What is the long story about? She now started that during the antenatal care, they used to be 8 in a row. That is, they were like 8 friends that met themselves in that antenatal care. And they usually come from almost the same area, so it's more like they bought the same bus and the same transport bus, and they all go almost at the same time. That means anybody that finishes waits for each other until they are complete before they go. So they actually formed good clique, good friendship. So one of them by name, let me just use X as the name. She discovered that one mostly is a bit withdrawn from the others. So most times you end up being the one to greet her. If you do not greet her, she doesn't greet you. So they were not really very good friends. Then during the delivery, during this particular lady's delivery, this ex-lady's delivery, she didn't deliver in our hospital. She most likely delivered elsewhere. So that means by the time of their delivery, about 3 delivered before this particular twin gestation woman, then the rest delivered after her, almost like in space of days. In fact, within that week, all of them delivered. But this particular ex delivered outside. So this twin gestation lady said the second day after delivery, she came for the first immunization, the immunization that she was meant to take on the day she delivered the baby. She came for it on the second day of delivery because she was discharged after 24 hours. So she now came the next day. So when she came for that delivery, this ex was meant to have delivered like 2 or 3 days ago. So she went and got two of her baby immunized. When she was now coming out, she met this ex, and to her surprise, unlike her usual self, the ex saw her, smiled very cheerfully. So this my patient rushed to her and hugged her, greeted her, and of course it was obvious that she was no more. She has delivered, the belly has gone down. So she was now asking her, wow, what are you doing? Did you come for immunization too? She said no. She now asked her, so where is your baby? She pointed at one end. So this particular my patient assumed that place she pointed was maybe where the other friends are seated. So maybe one of her relatives is carrying the baby. So my friend now said, okay, that she's been here and that she's really rushing out for something, that she wants to go go out and do whatever she wants to do. So the twin gestation woman now left. The next immunization date she came, as she was leaving, she still saw this ex at that same point, at that same location where she saw her the first time. So she now came out like, wow, it's like we always meet here. And they both greeted. So as they were now greeting, she now told her, please, that she should help her carry one of the babies. Let her rush back and get the drugs that they wrote for her. The pharmacy is just very close by to that place. Let her just rush and get one of the drugs from the pharmacy. So that one cheerfully collected the baby from her. As this thing was happening, there were people around. It's not like she was alone standing there. So she gave the male child, because the boy and get the male child to her, and now rushed to the pharmacy to pick the drugs. When she now picked the drugs, she came back. She saw the bag that she was carrying, that she gave the baby with. There was a bag she gave the baby. The bag was there on the floor, but the baby was not there. The baby and the lady was not there. So she now asked the people around, what of the woman that was carrying the baby? So one of them pointed at one very end. And that place the person pointed was actually still that area where the woman initially pointed that her own baby was. So this my patient assumed that, okay, maybe she took my baby towards that area, towards that side. So she now came towards that. She was going down towards that side. There was really no particular area. There's no particular location that place is there. Like there's no particular facility there. It's not like there's a ward there or there's no PD there. So at a point, she started coming back to ask people, is there any place people are meant to gather here? One of the ladies there said, well, I don't know. Maybe you should go and ask the hospital staffers. So as they kept asking and asking, time was going. And she kept coming back to that location to check whether the woman has returned. The woman didn't return. So after like about 4 or 5 hours, she now raised the alarm and started calling security, calling the hospital authority that what is happening, that she gave this woman her baby. Please, they should help her trace this woman's number and those things. And the woman pointed that her baby is over there. And some of the people that she was staying with also pointed that the baby, that the woman went towards that location. So she doesn't really know what is happening here. She doesn't know what is happening here. The people came, they started trying to trace the woman she was talking about. She gave them the name. They went to the phone. They said, well, this one didn't deliver here. But these are the numbers of the woman. They tried calling the number didn't ring. So later on, when they then told the woman that there's no problem, she should go home, and if by tomorrow they don't see the woman, then she can now file a report with the police. And maybe the woman just went out to do something, and she's still going to come back. The woman refused to go. So, but when it was now late, her husband came and picked her and said tomorrow they're going to come back. So by the time they were coming back tomorrow, the hospital now told them that, well, that they called the number and somebody picked the number from this woman's household, and they said that particular woman she was talking about has died, and the woman died during child labor. So I don't know. And then the particular woman that was telling my patient this now asked, where did you say this patient was pointing at that her baby was? He pointed at that area. That hospital staff told my patient that place, the only thing there is the mortuary. It's only mortuary that is down there. There is no other facility there. The woman said, what do you mean mortuary? He now told the woman, come, let us go and see. So when they now went in there, when they came into that place, the hospital staff asked the mortician, please, what facilities? The mortician said it's a mortuary. This one now said that there is a woman that delivered, that she was pointing that her baby is there. That mortician said yes. So yes, about 9 days ago or so, that there is this lady they brought here. They say she died on childbirth, and they brought both her and the baby, and they are still here. This woman, this particular woman now went into that place. When they went into that place and opened the sheet they used to cover that particular woman, they discovered that there is 2 babies there, and that is her baby and another child. Now the other child the newer child has decomposed so badly that it's difficult to dictate which particular child it is. But the mortician said they recorded just 1 baby, so it's obvious it's this woman's baby that this particular lady has carried. Wow.